Hello. Welcome to this FIP CPD Bites. Today's presentation will provide insight on the self-care continuum, focusing on the role of the pharmacist. The main objectives of the presentation will be to provide an understanding of the healthcare continuum, explore the balance between self-care and care provided by healthcare professionals for different types of healthcare problems, explaining the role and contribution of pharmacists throughout the self-care continuum. My name is Sham Moodley, and I am a community pharmacist in South Africa. The WHO suggests that self-care interventions are amongst the most promising and exciting approaches to improving health and well-being, both from the health system's perspective and from the user's intervention. Self-care interventions hold the promise of being good for everyone and moves us closer to realizing universal health coverage. Historically, self-care has been practiced in many cultures and communities across the world and has been an important part of pharmacists' daily practice. Of recent, the application of science and practice has allowed us to conceptualize internationally recognized frameworks. It is seen as an important contributor to universal health coverage. In terms of the value of self-care, it allows us to define the full scope of practice of healthcare professionals. It encourages individuals to take control of their health, and it contributes to substantial savings on an already strained healthcare system. It also represents one of the most promising approaches to improving quality of health and achieving health equity. With the estimated shortage of some 18 million healthcare workers by 2030, and 400 million people worldwide already lack access to the most essential healthcare services, and a further 100 million people plunged into poverty because of out-of-pocket healthcare spending, it is imperative to find innovative ways within our profession to support an alternative, effective strategy to redeem the situation. The continuum relates to the spectrum of an individual's health and well-being, and it defines the extent to which the individual may manage health problems on their own or may need the support of healthcare professionals. The continuum also specifies the type and extent of the support needed and the shared responsibility between the individual and the healthcare team by describing the main activities and elements of self-care relevant to the individual. Furthermore, by placing the individual along the continuum, it helps to define the resource utilization. The self-care continuum starts with the individual choices, and as people progress along the continuum, more facilitation by healthcare professionals is required until a person needs full managed care. However, whether an individual can self-care to a higher or lower degree does not depend solely on the conditions they have or on its severity, but it includes their level of health literacy. For example, the emergence of long-term NCDs as a major health issue around the world has put the spotlight on self-care. Through self-care, people can delay or prevent any chronic diseases such as coronary heart diseases, stroke, diabetes, cancer, in which an unhealthy lifestyle is well established as the key causative agent. Many countries have incorporated aspects of self-care into policy through innovative practices. The WHO recommends self-care interventions for every country and economic settings as a critical component of the path to reach universal health coverage and to serve the vulnerable. The key to healthy living is striking this balance between informed self-care decisions and seeking professional interventions by more complex issues. It is best to encourage patients to engage with pharmacists on their journey. If informed self-care is required, pharmacists can help to provide the best possible options to inform choices on their self-care journey or guide patients to an appropriate healthcare professional if required. The pharmacists across all sectors, including patient-facing healthcare professionals, academics, and researchers, can play various critical roles in self-care. Community pharmacists are in a very unique position to provide care to patients as they are conveniently placed at the heart of most communities and especially accessible and well-trained. The trust relationship allows the pharmacist to provide solutions to common ailments, educate on medication management, and provide advice on the management of long-term conditions. Academics need to ensure that the graduating pharmacists are well equipped to provide this delivery shift, and pharmacy researchers are tasked to review new evidence and provide the science and knowledge necessary to make self-care, this approach, sustainable. In general, pharmacy as a profession needs to also play an advocacy role to ensure that individuals, families, and communities are empowered to optimize their health outcomes. The foundation of self-care is largely based on users' level of health literacy, which aids their self-directed decision-making and their appropriate engagement with healthcare systems. There's sufficient data to suggest that pharmacist interventions in improving patient health literacy empowers better patient decision-making, delivering information at the level of patients' ability and engagement improves their well-being. Pharmacy has been adapting and promoting health literacy with many unique techniques, including teachbacks, using patient-friendly language, drawing on diagrams, and demonstrating equipment usability, all of which encourages individuals to take an active role in their health. The use of MTM, medicine use reviews, and medicine reconciliation by pharmacists substantially improves medicine effectiveness and health outcomes. With digital health having the ability to improve health literacy, it does require substantial patient understanding and training on this technology, interpretation of results, and on point-of-care testing measurements. Pharmacists and their teams are well placed to provide this essential link between technology and outcomes measures. Closing the gap in the self-care continuum from primary to tertiary care is an important gateway role of pharmacists. Facilitating the education process at the lower end of the continuum to managing and advising patients through this complex journey that they're on via collaborative practice models is an important pharmacist-patient partnership. So in summary, we have an opportunity to redefine the role of the community pharmacist in self-care and shape the future of primary healthcare. It does require a mind shift change from managing sickness and product to promoting wellness in a patient-centered approach. The task at hand, though, is to mobilize the profession to support self-care, along with its critical prerequisites, such as patient and consumer empowerment and health literacy. In this next slide, you will find the reference source that I used for this presentation. And in the next slide, there's further readings on the subject matter for your interest. I thank you for listening. Take care.